Okay, Jimbo, you're here today to help us with we're going to assess your thorax, your lungs, and your abdomen. Okay, I have Jimmy facing where his posterior back faces. We're going to look at his back and see that it's symmetrical and even. The skin color is the same throughout. He's got his hands in his lap, so he's obviously has ease in breathing. He's not having any difficulty that we can note. I don't hear him breathe, so there's no obstruction or anything associated with that. Okay? I'm just going to palpate your back right quick, okay? And of course, if you have any tenderness with any of this, let me know. Or pain. All right? Now we're going to percuss. And we hear a dull sound over the lungs. And we're going to check for tactile fremitus. Okay? Can you just say 99?
99.
Keep saying 99.
99. 99.
Good spacing.
99. 99. 99.
Okay? And resonance was even throughout. We're going to check for diaphragmatic excursion first before we listen. Okay? Start at the lungs. Go down till we hear a dull sound. Marker spot. Okay, and keep on. Our second dull sound, and these should be 3 to 5 centimeters apart. And we're going to repeat on the other side. And the right side may be a bit higher than the left side. These can be as much as 8 centimeters apart in a well-conditioned athlete. But Jimmy's an athlete. We don't know about the well-conditioned part. Just kidding. Okay, we're going to check for symmetrical chest expansion. Okay, take a deep breath in, and out, and in, and out. And my hands moved apart evenly, so we have symmetrical chest expansion. Okay, we're just going to listen. Sounds. Listen for one full respiration. Okay, we got bronchivesicular sounds up towards the spine, and we have vesicular sounds over the abdomen. Okay, Jimmy, if you could turn around and let me see the front of your chest.
Going.
All right, and as we did with the posterior chest, we're looking at the anterior chest to make sure that everything is symmetrical. We don't have any growths or lesions. We've got the keratosis that was in the back as well. He's sitting there with his hands in his lap, so he's showing ease at breathing and no difficulties associated with that. Okay, you kind of look at your fingernails. Okay, we're looking for any cyanosis. All right, and the skin color across his chest is even also, and we don't have any cyanosis in his fingers. Okay, so we're just going to gently palpate like we did in the back. Okay, and as before, let me know if you have any pain or tenderness associated with me over these spots. Okay. All right, you good? Okay, and we're going to check for tactile primitus also. In the front, it's 99.
99. 99. 99. 99. 99. 99.
Okay, and we have even resonance throughout. And we're going to check for symmetrical chest expansion. Okay, and take a deep breath in and out, and in, and out. Okay, and my hands moved away symmetrically, so we have symmetrical chest compression. Okay. We're going to percuss. You notice that it's dull over the lungs, and we have tympany when we get down to the abdomen. Okay? And let me listen to you. Sounds good, okay? One full respiration. Okay, we have bronchial sounds towards the trachea. We've got bronchosectional sounds up here in the middle of the chest towards the sternum, and we have vesicular sounds over the lungs. Okay, and if you notice any abnormal lung sounds, you can do the 99 test.
Right.
All right, you say 99 every time. Stethoscope hits your chest, say 99.
99. 99. 99. 99. 99. 99.
Okay, and you picked up bronchophony if you hear the 99, but everything sounded muffled, so that's actually normal. Okay, that'll do us for the thorax and lungs. Jimbo, just keep sitting up for me, okay?
I'm going to tell you that
We're going to start on the abdomen here, okay? And while you're sitting up, I'm just going to go ahead and do your kidneys here. We're going to grab here and thump. Okay, do you have any pain or discomfort associated with that?
no, ma'am.
Okay. How about that?
I'm good.
Okay, now you can go ahead and lay down, and we'll start with your
Before
abdomen.
you do that,
We're gonna lay down and for your abdomen here. Okay, Jimmy laying down. We're gonna look at the abdomen here. Thank you, you're good. Okay, we're gonna make sure your abdomen's either flat or rounded, and Jimmy's is a little rounded. He's got the keratosis that was in front. Skin is even toned throughout the abdomen. He does have a midline chest scar, and that's from some surgery whenever he was 4 years old, open heart surgery, or an atrial septal defect. He also has some stria on the right side of his abdomen here. His weight kind of goes up and down a bit. We're going to shine a light across the abdomen. Okay, and look for any bulging or any pulsations, which we don't have. Jimmy, can you take a deep breath for me? Okay, and we don't notice any pulsations or any bulging whenever he takes a deep breath, which is going to tense the abdomen. Okay, we're looking at the umbilicus, which is inverted. It's not red or anything. No infectious process looking like it's going on with the umbilicus there. So the umbilicus is good. All right, and with the abdomen, you auscultate first because you don't percuss or palpate first because you could bring on breath sounds. Abdominal sounds, and make them hyper. Start off at the ileocecal valve, which should always have vowel sounds. And vowel sounds are designated as being hypoactive, normal, or hyperactive. Okay, and Jimmy's are normal, and we're going to listen for bruits now. Okay, going to listen at the aorta. Okay, the renal arteries. And the ileal. and the femoral. Okay, and if the person had a bruit, it would be a whooshing sound that you would be listening to that. Okay, we're going to try and palpate your liver here. Okay. Okay, and Jimmy was trying to tell me that we dropped our pen, so I would be marking here. I don't know where my marking pen went to. And continue down till we hear a dull sound again, and that should be 6 to 12 centimeters apart. Okay, with the liver. Okay. And while we're doing that, we'll percuss your abdomen. Tympany should be dominant, which we have tympany throughout the abdomen, and then we're going to lightly palpate your abdomen, okay? Okay, just let me know if you have any pain or discomfort. Move around here. You good?
Yeah.
Okay. Then we're going to do a little deeper palpation. Relax. Okay. And good on that. Okay. Thank you. And then we're going to feel your. Okay. I'm going to feel your kidney here. Good. Feel the edge of his kidney. Okay. And we'll do the left side. Now, no, I don't feel it over there because you're not supposed to be able to feel the, palpate the left kidney. All right? I'm going to try and palpate that liver again, okay? Honey, you got to have your hands by your side.
Oh, sorry.
All right. Take a deep breath. Hold it. Okay? And I feel the edge of the liver right where our mark should be. And then we'll try and do the spleen. Okay, deep breath in. Very good. Okay, and we don't palpate the spleen, but you're not supposed to be able to palpate the spleen. Okay, and then if Jimmy had complained of any abdominal pain, there's a couple of tests that we can do. One is if he complained of pain on the left side of his abdomen, we would push in on the right side of the abdomen and let go, and rebound tenderness would occur. Then that would be a positive sign. Also, if he had complained of pain on the right side, we would push in on the left side. And the same thing, if rebound tenderness or if he had pain in that referred area, then that would be an abnormal sign. You can also do a Murphy's sign, which I happened to have seen done the other night at the hospital by a lady that they thought she had gallbladder trouble. And push in where the liver should be up here under the costal edge and get him to inhale. Take a deep breath in for me. And if they're not able to finish that inhaling, which he was able to finish, then that would be a sign that they have gallbladder trouble. And you're done. Thank you. All right, and that's the end of our thorax, lung, and abdomen assessment.